The Honourable Member. It's a pleasure for me to speak today about the motion, and talk about the extraordinary work my colleague has done. This brings to light something that will have monumental consequences: the future of advances in the field of public health and the Canadian healthcare system. This is something I care deeply about. I think there are real benefits to consider for research subsidized by the federal government, and I'm sure that a study done by the Standing Committee on Health will confirm this conclusion. Before coming to Canada and completing my studies in translation, I worked as a nurse in Lebanon during the Civil War. I witnessed horrible circumstances, and I had to take care of patients who had to deal with illnesses that we don't know in the West. I've seen everything. The most debilitating infections, the most unimaginable sufferance of the victims of physical and psychological violence. The precision of surgical procedures that were used, effective treatments against viral infections, all this I think we can attribute to medical research and what it's allowed us to understand about the complexity of the human body. In Canada, we are extremely privileged to have access to a universal healthcare system which gives Canadians the opportunity to take advantage of healthcare anywhere in the country at any time, and through a system of cooperative funding. Even if the system is not perfect, it is the envy of countries worldwide. We have to have these discussions if we want to improve our social services. We're in a constant state of change with respect to how we envision services and how we can make them accessible to the public. I believe that Bernie Sanders recently visited Toronto to study our healthcare system and to discuss the present situation in the United States and to get inspiration from the Canadian model. There are criticisms that could say that our present system is dealing with unexpected budgetary changes. And this is where research becomes important. We can revolutionize the delivery of service and healthcare costs. I support this motion, Mr. Speaker, because I think it brings to light the situation which shows that there is need for government assistance in health research. When federal governments invest in health research, we have real concrete results. Discoveries have deep consequences for our health, our safety, and our quality of life. Vaccines, laser, tactile screens, networks, and the internet are examples of innovation which have benefited from investments from the federal government. We know that these things have a positive impact. The development of new technologies, such as those mentioned earlier, can affect our daily lives and play an innovative role in our society. Each of these inventions is used in hospital environments and has revolutionized the system. Another very positive element that should be borne in mind, and this quite apart from benefits for the healthcare system, is that this will also allow for the creation of new jobs. These include the main researchers and their teams, technicians in laboratories, manufacturers, and all those who support in one way or another the system. There will also be indirect jobs created through new technologies, new companies, and new industries which offer new services or products, which will be the happy result of these extraordinary discoveries. All this encourages us in supporting Canadian industry. We are world leaders, and we have world leaders here in Canada in the field of medical research. and research is essential for many industries.
Before me, we can reduce the cost associated with the production and delivery of drugs. We can reduce the cost of providing services through enhanced and more targeted treatments. This simultaneously results in the most efficient delivery of healthcare services. Most efficient delivery of healthcare services, which is good news for our patients. And of course, let us not forget the most important aspect of health research is the results. The Canadian public benefits from innovation in medical procedure, our advancement in pharmaceuticals and vaccinations, and our understanding of diseases. We build the foundation of a healthier and more informed population. The health and well-being of all citizens is central to poverty eradication and is a laudable goal that we should never give up, no matter how skeptical you may be. I would like to take a moment to reflect on comments made by the Honourable Member of Calgary-Shepherd during the last session of this debate, if I may. He raised the point of rare diseases, and I think that is an extremely important component for this debate today. I believe he made reference to Alport syndrome, which up until that point I had never heard of, even having worked in the medical profession for many years. We have a duty to our citizens and to the people of the world to create a better life and to relieve human suffering. If left to the market, so to speak, or up to chance, while we wait for the private sector, some of these serious ailments may not be addressed either adequately or at all. This is not meant to be a criticism of any of our medical institutions or leaders in the medical research here or around the world. It is simply an observation that there are a great deal of individuals who are left with little to no hope because there is virtually no information on the relatively scarce conditions, leaving little incentive for researchers to pick it up. We need to fill this gap. We need to understand that it is as important to find cure for cancer or HIV as it is for, say, Alport syndrome. We need not qualify or quantify suffering. Now, this is an arduous task as there are thousands of rare diseases, but you have to start somewhere. It has been mentioned a few times already by other speakers on this subject, but I would be remiss if I didn't address the progress made toward the eradication of infectious diseases around the world already. Smallpox, the first and the only human disease to be eradicated through human intervention. Rinderpest, a disease that affected cattle, has declared eradicated as of October 14, 2010. This was the first and only disease that affects livestock that were eradicated by human undertakings. Current interventions aim to eradicate polio, malaria, measles, rubella, and the list goes on. Medical research and human intervention is the only way forward. No one else is going to do this for us. We have a common goal, and federally funded research can play a positive job. Before I finish, Mr. Speaker, I would just like to make reference to a particular event I had the privilege of attending that was showcasing medical research here on the Hill only about a month or so ago. Here, I learned a great deal about CRISPR genome editing, something used in both health and agriculture, if I understand correctly. In relation to health, one of the areas being utilized is the fight against HIV. Using CRISPR, scientists were able to eliminate HIV in live animals because HIV DNA can be excised from the genomes of living animals to eliminate further infection. What marvelous genius this idea is. This is what we are working for, to strive to support the empowerment of our brilliant innovators and scientists who will change the landscape of medicine and public health. Monsieur le Président.
Mr. Speaker, I'd like to thank all those who have spoken in favor of this motion before me, and thanks especially to the member for Kitchener Centre for having brought it to our attention here in this House. Thank you, Mr. Speaker. Resuming debate.
Member for Mark.